Hi, everyone. Thank you so much for joining us for day one of Emerge Workplace. I am now joined by our speakers from several of our sessions today, Mathieu Despard from UNC Greensboro, Ryan Igleheart from Humana, and Naim Kabir from Even Responsible Finance. Before we dive into our closing roundtable, we want to get a pulse from you, our audience, about what you are finding valuable about Emerge Workplace today. In just a moment, you'll see a poll pop up on the screen, and we will just take a minute to ask folks to chime in and respond to the poll about what you're finding valuable about today's sessions. So what is the most valuable aspect of Emerge Workplace thus far? Is it gaining a better understanding of the impact of workplace financial health, learning new tools to address the financial health of your company's employees, hearing real-world case studies, and engaging with a community of peers? I know for me, it's been all of the above. So we'll just wait a minute or two for those results to pop up on the screen. In the meantime, we'll be diving in shortly to our roundtable. Really want to thank Ryan, Kabir, and Matt for sticking around. We're going to just draw on a couple of themes that have come out thanks to all of the really good listener questions and comments. So while we wait for the poll results, why don't we dive in right away to the first theme. I think a really interesting theme I actually heard throughout basically all of the sessions today, it relates to company culture and aligning workplace financial health to an organization's culture. In our first session, Grace spoke about how for Chobani, investing in the financial health of their workers is not just about helping workers with their needs, but also aligning, it really aligns to Chobani's brand strategy and how they communicate with their consumers about the type of company they are and about their culture internally as an organization. And you, Ryan, in our session spoke about culture as well and how financial health and investing in your associates' financial health ties to your talent strategy. So I'm curious for each of you to comment about how either in your own organization, in your case, Ryan, or in other organizations with whom you work, how are organizations communicating about their financial health efforts, either with consumers or clients, or with your current or prospective employees? Maybe Ryan, we'll start with you, and then we'll open it up to Matt and Kabir.
Sure, I'd be happy to lead off, and I would start by saying that these are difficult conversations, and I think that in corporate America as a whole, I'm going to generalize here, but I think that we're a little bit behind in terms of a comfort level talking about personal finances, financial well-being, etc., compared to where we were health-wise and that kind of thing. I think that as it becomes a business case for addressing some of these things, it really becomes more important for an organization to really embrace, and you find more and more people across the country in corporate settings being willing to embrace this. That was true with health assessments and biometrics, 10, 15 years ago, and increasingly I feel like, now is part of the moment for financial health. For a long time, it was a conversation around, well, are you putting enough in your 401k? And there was a sort of assumption that, saving at a certain rate, amassing a certain amount in a defined contribution plan was the equivalent of assessing somebody's financial health. I think now that there's a realization that it's much more complex than that. Short-term needs, long-term needs, complex needs brought about by emergency savings versus credit and debt issues. And I think in all of that, there's really a need for empathy and for being okay talking about some of the messy aspects of this, because it's not necessarily clean, and there is no right or wrong answer. There's a lot of variability, and so I would just sort of say that in general that that is part of what we experience as a company, and more and more leaders are showing that they're willing to go there and they're getting better at having those conversations. The last thing I would say is in our company, the number one indicator of whether an employee is engaged is whether their direct leader cares about their well-being, as evidenced by that individual's perception of whether their leader cares. And so financial well-being is just one component of that, but that really does have an impact on whether or not those employees come to work, are engaged, are producing, are really driving the company forward.
Yeah, what about you, Kabir? What have you seen in the companies that Even works with? How are companies communicating about financial well-being, either with their end users and customers or with their employees themselves?
Yeah, I mean, I can't comment on exactly how they communicate with their employees. I can definitely comment on what the literature says is the right way and the wrong way of going about things, though. Like, for example, paternalism is probably going to be the wrong way of going about things and will generally make people shut down. Like if you are very prescriptive in how you should be managing your financial life instead of being open, understanding, and meeting people where they are, they will probably not want to talk to you about that. And touching on what Ryan just said, yeah, like PwC released that one employee wellness survey a couple of years back where it showed that people actually care whether or not their employers care about their financial status where they are. So I think a lot of the communication has to be listening. It's got to be like, where are you? How do you think about how to manage your own financial health? And not so much telling people what to do, because that's just going to shut people down, I imagine.
Matt, love to hear your thoughts on this theme.
I love how this conversation is framed around company culture, because in terms of the way the company communicates to its employees about these issues, well, the way it's received, which is really more important, I think, will depend on how employees already feel about the company. And if there's a culture in which employees feel that the company does value them and value their contributions and provides, the best, quality of job and pay and benefits that the company can reasonably offer, then the message will be received. And the opposite is true. If employees feel like, well, wait, where is this coming from? Why all of a sudden does this company that I don't feel very valued by seems to be interested in my financial well-being? I'm kind of skeptical.
Yeah, I think the importance of authenticity and being transparent and clear about the reasons why the company is investing in financial health is a really critical component. I want to turn to another theme that I heard in several sessions, which is around making financial health not just an HR priority, but really making it a business and enterprise-wide priority. I think, we talked about this a little bit too in our session, Ryan, when we talked about the importance of the impact of making the data so broadly available across the company to leaders across the company, and how that influenced decision-making and buy-in at senior levels of leadership. And I know, Matt, that's a big focus of the work that you all do on impact evaluation, is really helping organizations demonstrate the impact of companies, of the solutions that they're offering to their workforce. So I'm curious, maybe Matt, starting with you, how have you seen this differ based on the size of the company in terms of using data and unleashing data to really demonstrate both the need and the impact of the solutions being offered and securing that buy-in from leadership?
Yeah, I'm a big believer in, to the extent possible, companies leveraging their human resource information systems to figure out how the introduction of these types of benefits, or really any other types of benefits, may be associated with certain metrics such as turnover or absenteeism, and at least to see does there seem to be something happening here, and but at the same time to use those systems to look at how the company's operations may be impacting employees in other ways. Are employees struggling with absenteeism because work scheduling is very difficult for them, because they're juggling multiple demands in their lives, caregiving demands of older relatives or children. And we definitely see that, as you might imagine, among women employees. And also we're really cognizant of the fact that people of color have a set of burdens that are greater than others. And so just looking at holistically what the company is doing, how it may be impacting employees in multiple ways, such as scheduling, and as much as possible, digging into their own data to help answer some of those questions.
Yeah, Ryan or Kabir, I'm curious for your thoughts. What would be, if someone in the audience is listening and thinking, yes, I understand financial health is important to my workforce. I have a sense of some of the ways I might start gathering some of the data I need to demonstrate that, but how do I make the case to leadership? How do I secure buy-in? Where would you suggest they start, or what would you suggest they do? Ryan, let's start with you.
I was going to wait for Kabir to chime in with a clever answer. But I mean, I think from my perspective, I would say that there really is, from where I sit within a company, trying to offer our associates the right mix of benefits and support and education. I would say there's actually, not as much literature out there as we could use to actually justify, exactly what we'd like to offer. What Matt was speaking to, I think that there's some consultants and some studies out there, that can be referenced and sort of extrapolated from, but there's not a lot of great systems, I think, for actually analyzing the real impact when you implement a solution in a real live company. And there's just a lot of other variables that are in the mix that are happening at the same time that, Kabir and I actually have talked about, experimenting in a corporate culture. And one of the reservations is that we don't want to literally be experimenting on, one population of associates versus another, giving them a different experience that would potentially be suboptimal for one versus the other. And so I think that there's, I would say I don't have a lot of great answers other than to say that that's something that we continue to look for, find ways to collaborate on and really share best practices all around this sphere, from academia to, consultants, vendors, companies, employers, et cetera, because I think that when that information is shared, it only puts us all in a better position to actually support the wide range of associate needs.
I do want to touch on this. So I think the heart of your question, Beth, was, how do you get buy-in for doing impact measurement at all in the first place? One really easy way to do that is to get a pilot set of measurements. Like, for example, if you were to go out, just do a random sampling and survey people using something like Financial Health Network's Financial Wellness Toolkit or any other survey instrument you find that's been vetted and is reliable, and you can tell that there is some segment of the population of the company that's hurting or not doing well, or they're vulnerable, that's something that leadership is going to want to know. You're going to take this information that people were blind to at some point and throw some light on it. And once people know that a problem exists at all, they're going to want to keep tabs on it. And from there, you can start doing live measurement and do it more regularly, expand it, and then that naturally leads to, okay, doing impact studies. You have these measurements. Now what are you going to do about it? So that's when you bring in vendors, benefits, interventions, and you can do tests. You're just okay, what's driving this down? What's driving this up? But it's very difficult to argue with a method and some numbers if you're just hey, 34% of our population is hurting. People can't ignore it. So just doing a random survey might be all you need. Collecting something might be all you need.
Yeah, I really appreciate that, Kabir. I love the suggestion just to start with what you have. Not strive for perfect, but just start where you can, start where you are. And maybe I think we have just a few minutes left in our closing minutes. Maybe Ryan, I'll ask you for the last word. You have dozens and dozens and dozens of metrics that you've been able to develop and gather and compile over time in the 11 years you've been working on the snapshot. For someone who might be just getting started, either understanding their employees' needs or trying to understand the impact of benefits they have in place, where would you suggest they begin beyond just a survey? What might be one or two metrics that you suggest, a handful of metrics that they should look for?
Yeah, absolutely. I think Kabir was right on point, with from a financial perspective, I will say that the, Financial Health Network FinHealth score is a super simple survey that actually gets at some of the base behaviors and can help target any interventions you're looking to support. So in financial health, we actually started using that measure, this January and are getting a baseline and are going to be tracking that going forward. So I think that's a really good place to start. I do think that naturally most employers of any size have some partners already at the table, typically a 401k provider and that kind of thing. And while that is not necessarily the be-all end-all of financial well-being, if you're looking to start at square one, they probably already have some capabilities as a third-party administrator of a financial plan, planner for you, that they can actually come to the table and really help you think about, who appears based on the limited available metrics to be on track, who might be, who might be falling behind or have an opportunity to be nudged and educated. And oftentimes those providers in the past were providing a service. Now they really are, providing education and they're providing other tools as well. So I think that using those partners in place probably is a really good place to start. And they probably have more tools than we all realize to actually make a difference once you've started to measure with them.
Yeah, thanks, Ryan. I appreciate that practical advice. As I look at the results of the poll we just did, the two top things that people are excited about or have found valuable in today's sessions are learning new tools to address the financial health of my company's employees and hearing real world case studies. And I think this discussion we just had is really typifies that. So want to thank you all for your time today. This brings us to the conclusions of today's sessions for FinHealth for Workforces Learn What Works. Before we wrap, I encourage you to join us tomorrow at 10:30 Central, where we'll be hearing from leading experts in employment and human resources on the critical relationship between business innovation and financial health across industries and demographics. We hope to see you then.